so I could feel a little more comfortable. At least I have SR. I got an SR at the end of my name. Because I had no idea what some of these initials meant after some of the guests that we have here to talk to us this morning. We're blessed to have Catherine Bentley that's going to speak to us this morning, Giselle Jones, Dr. Audrey Krebs, Dr. Denise Myricks, and Dr. Daniel Sanders. And if they could come to us in that order, this is very casual. You see they're sitting here relaxed. They have a microphone there. They're going to talk for about 5 minutes or so on how maybe what they do has an impact or applies to what we're here for today in that caregiver range. And then you'll have an opportunity to, like I said earlier, to go to a microphone and ask any questions that kind of pop into your head that resonates with you once they get finished, okay? But we'll have them all talk first, and then we'll turn the mic over to you all with any questions you may have. So in that order, Catherine Bentley, Giselle Jones, Dr. Krebs, Dr. Myricks, and then Dr. Sanders will finish last. No, you could sit and relax and talk from your chair.
Okay. Oh, good morning. Okay, good morning, everyone. Thank you for coming. As stated, my name is Catherine Bentley. Everybody calls me Kathy. I'm a registered dietitian. I'm coming to you, and this is my church, so I'm happy to see everyone here as well. From a personal standpoint, I was a caregiver to both my parents. My mother passed away in 2013 after me having to bring her up here to Akron. She was from Springfield. But I was not able to utilize those services as well in Springfield, so it was better for me to navigate her care by bringing her here. And as we know as caregivers, it can be a challenge. And from speaking from a dietitian standpoint, and I always say nutrition is a cornerstone of every disease. So self-care is very important along with making sure you get adequate nutrition. So because if you can't take care of yourself, you can't take care of your loved one. So we know along that journey, it can be stressful, but trust me, I would do it all over again if given that opportunity. So from a nutrition standpoint, we need to make sure that we get adequate sleep, adequate hydration, and make sure that you take care of yourself and eat. Because I can't tell you, there were numerous times I would feel weary and then realize that I hadn't eaten because I'm trying to work, trying to take care of my family, trying to take care of my mother all at the same time, and you tend to put yourself second. And so as being a caregiver, it is very important that you factor in self-care. Find your people, find you a friend, find you a support person as well, because you do need a break. There would be times when, I'm gonna be quite honest, I would just be frustrated. You know, I'd get up, I'd go to work, I'd come home, I'd fix my mom lunch, I'd go back to work and try to coordinate all those services with a child and a husband and maintaining your home. And so you would put yourself, I felt second or third or fourth or fifth. And so it's very important from a nutrition standpoint, just a whole body, to try to carve out some time for yourself. Because I said, I'm a dietitian by trade, but I'm also a nurturer and a caregiver. So you always want to take care of your loved one, but you have to take care of yourself as well. Also, that's just, like I said, find your support people. If you don't have someone, get connected. We have a bevy of resources that you can utilize because there is always a tendency to not take care of yourself. And as we know, stress brings about diabetes, hypertension, and if you don't take care of yourself, you can't take care of the loved ones that you have. So I don't know if I extended. It seemed like I talked very quickly. So if you have questions later, I'm available. Who's next?
Clinical social worker. And as a part of being a clinical social worker, I actually was executive director at Jewish Family Service for many years. And there I ran a And what we did was to provide those services, in-home services, for seniors so that they could get some of the care that they needed. And so I had that ability to get in contact with lots of resources in the community and to talk to a lot of those professionals that would be out there to help you, supposedly, in your journey in the caretaking of your loved one. Now, despite all of that, when it came to my journey and learning to prepare and take care of my mother, it meant nothing. So all that preparation that I thought I had, all this preparation that you might hear with all the resources, which is good. I'm not denying how good this is. It will be helpful for you. You will not be prepared for this journey. You really need the Lord. You will need the Lord for this journey, because how much you loved your loved one, and I love my mother to death, but it did not prepare me for what I'm going through right now. And I think it's important for all of you to know that this is not an easy journey. And you will need the Lord by your side as you do it. When I began taking care of my mother, it was very difficult. We saw that she was beginning to make some changes in her lifestyle, and we weren't ready to deal with her regarding those changes. So we let things go for a while, because my mother is strong-willed. She's from the South. She worked hard to get what she had. She had a home that she struggled with. You know, she was able to finally work her way up to have a state job with a pension. My mother worked hard, so she wasn't giving up any of that with any kind of ease. Despite this little professional here, which she said, just because you're a professional, got your little education, I mean, you're not gonna tell me what to do. So over time, we had to watch my mother slowly deteriorate until we got to the point where, as a family, I had to call the family together and said, hey, it's time for intervention. And even then, after we did the intervention with much, much pushback from my mother, it still took a lot of time and for things to deteriorate even more before I was able to use even some of the resources to get that beginning diagnosis that she needed, so that we can begin the process of some care. And even if you get the diagnosis, we got self-determination. So we can say, oh, this is really good for you all you want, but that doesn't mean that that loved one is going to agree to that care. So this is an ongoing kind of journey, and I just want to point out that preparation, as much as you think you're going to be prepared, you're not. And it's going to be an ongoing journey with changes and seeking resources in all sorts of different ways. And I just want to, just make that out to you. You got to be prepared to not be prepared. Secondly, I think one of the biggest things is just the legalities involved in caretaking. That, our parents didn't talk about wills or getting prepared for death, or didn't talk about power of attorney, those things that we need legally to navigate the healthcare system. My mom didn't know about those things, and when I mentioned them to her, she was resistant. She didn't want to talk about those things. So it took, again, something happening to my mom physically. She broke her hip and ended up in the hospital, for us to have to, and doctors, to have to really confront her to begin to talk about these very important issues, because, again, I had that little education, but that didn't mean I knew what I was talking about. So the legalities involved in this caretaking journey is just very difficult, and you really need to be able to have contact with some people in your community, lawyers that are very familiar with geriatric legalities involved in their care. And probate court provides some documents and things like that too. But it's just a very, very important thing to be aware of, and you'll be navigating that whole thing from the time you take care of that person when they walk in your life until they're ready to move on with the Lord. So that's important. Then next, of course, we talked about all the resources. There are lots and lots of resources, but your finances are going to kind of govern how your resources are going to work. And that indeed can be another difficult journey. So my mom, because she had a pension and because she had Social Security for a while, I thought I was blessed because we were able, after a little while, she stayed with me. We were able to place her in assisted living, and she kind of thrived in this assisted living until 2 weeks ago. 2 weeks ago, she had pneumonia, and now my mother is in hospice. And initially, she went back to assisted living. Actually, it was 2 days ago. And I was there, and when I saw what happened and what was going on with her physically and what they actually were doing in assisted living, that day I knew she could no longer be in assisted living. So immediately, the hospice nurse that came out and I determined that, and I sent her right back to the hospital. So now we're in the process of deciding what is really best for my mother in terms of her care, and what can she financially afford. So now I'm faced with the fact that the assisted living place that she's at, she can no longer be there. They're not going to provide the resources that she needs. And some of the other assisted living, they may not either. So I am facing bringing my mom back home again, and what that means to bring her back home and to get her all the care she needs while she may be in hospice. She may be there a long time, she may not. That's up to the good Lord. But my job is to try to determine how to navigate that in her finances. So again, resources are very important, and you're going to need those as you take the journey. And then finally, we already spoke a little bit to it, and that is self-care. I have not been able to do all of this without the help of myself getting some counseling, ongoing counseling for myself, just to have a resource there. Of course, my friends and family, and I rely on God. I just rely on God. I just pray and tell him to take me where I need to go and helping me help my mom. And that's it for me.
Hi, I'm Dr. Audra Krebs. I work at SUMA. I've been doing geriatrics for about 10 years, but I'm a local girl. I grew up south of Canton, went to University of Akron, then went to Neomed, and then came back to SUMA for training, which is actually where I met Miss Kathy roughly 11 years ago. So I wanted to piggyback a little bit on what each of Miss Kathy and Miss Giselle had said about, number one, taking care of yourself. So at SUMA, we have a senior health center, and I don't know if any of you are familiar with the senior health center, but I am one of about 6 doctors and a handful of nurse practitioners who work at the senior health center to try to empower patients and families with the appropriate diagnosis at the appropriate time so they can access the appropriate resources. And so we actually, the initial evaluation up at SUMA involves our social worker taking the patient who is struggling with memory loss and doing some memory testing. And we actually separate the patient and the caregiver because we like to get the how the patient is perceiving his or her memory loss and how the caregiver is perceiving his or her memory loss. And sometimes it's very difficult to share in the same room with your loved one because many patients feel like, well, I don't do that. They don't remember how much they forget. And the caregivers, of course, love them, and that's why they are there. And they don't want to feel like, I'm outing mom, or I'm outing dad, or I'm making a comment on their intelligence or their life experience, because all of our patients have an incredible amount of life experience. For the most part, we see patients in their 70s, 80s, 90s. My oldest patient so far has been 104. And it's just really incredible to be able to serve the community in this way. And we actually have a pretty great team, I think, of interdisciplinary teams. So we have a social worker who works straight alongside of us each appointment at Summa Geriatrics. All of us as providers have the ability to speak with a geriatrics trained pharmacist. And then again, I'll kind of take you through what it looks like for the first and second appointments, which are usually the big ones. So the first appointment, and it does not require any type of referral. I know a lot of other subspecialists, pulmonology for the lungs, cardiology for the heart, endocrinology for diabetes. A lot of those types of doctors and specialists require a specific referral from a primary care office. And I think one of the things that Summa has done so right to reduce these barriers of access to care when it's already going to be difficult to get your loved one potentially there to have an evaluation, to talk about their memory. You do not need a referral from any other type of physician or nurse practitioner. You can literally call our office, and I have cards I'm more than willing to share for you to take the card, because you can call in as a concerned caregiver, whether you are a friend or a family member, and you can say, hey, I think that Ms. Smith needs to be evaluated and I'm gonna bring her in. When can we get her in and with whom? We have locations here in Akron. I work also down in Greene at an outpatient office in Greene. We have Wadsworth, Medina, and Barberton also. So ultimately, the first appointment we separate initially, and we have the social worker do or perform the memory testing with your loved one. And then depending on whether they're in the earlier stages, moderate, or the later stages of dementia process, we have the social workers sit and stay with your family member, because if there's any confusion about why they are there, they don't want to be alone, of course, because often as the caregiver, you are working as their executive function. That happens in the front parts of our brains. Visuospatial and executive function both occur in the front parts of the brain, and those are some of the processes that dementia addresses at the very beginning and starts to affect. So you really are, if you notice your family member, your friend, whoever you're caregiving, starts to shadow you, follow you around, doesn't want to be left alone, doesn't want to be in a different room than you, it's because you are their safety, you are their decision maker, because whether they realize it consciously or subconsciously, they know that that part of their brain is having difficulty and struggling to make the correct and safe decisions. So then during the time that our social workers are evaluating with memory testing, I as the physician and the other physicians and nurse practitioners who work with our group are then speaking with you as the care providers and saying, how is their safety? Have they been leaving the water on? Is there any kitchen safety? Have they been wandering? What have you noticed about their short-term memory? We ask a lot of questions about their past medical history, because we know as care providers and as the medical team that history of high blood pressure and diabetes and strokes, all of those increase the risk of developing a specific type of dementia called vascular dementia. And I wanted to touch on something that Mr. Marvin Sr. said that either you are going to be caring for somebody that you know, or you will eventually be the one being cared for, and how I have seen this go both ways. Some patients are very open and willing to accept the help, and sometimes it's more difficult because they have not gotten to be the age they are and where they are in their lives by being complacent and just saying okay to everything that was ever presented to them. So we have special ways of being able to maintain contact with you as family and, especially at the appointment, sitting with your loved ones to reassure them. And then the second appointment is going over with the patient and the caregiver together results of blood work, which we order to rule out any other causes that might be contributing to memory loss, as well as ruling out any things that go on in the brain. So normally if the patient hasn't had any head scans in the last 5 years, we go ahead and check the brain to make sure there's no bleed, cyst, mass, cancer, anything like that that could be contributing to memory loss or changes in personality that are often perceived. And so we go over that, the blood work, the head imaging, the memory testing. We come up with an official diagnosis, and then we just let our social workers go wild. They are an incredible group of people. They have this whole bin of resources locally. When I did my fellowship from 2017 to 2018, I got to go for an entire month to check out the resources mentioned, probate court, elder law attorneys, and things like this. And our social workers are just so helpful for our team. So we try to support not only the patient who is being diagnosed, and sometimes it's not a diagnosis of dementia. Sometimes it's just memory loss, normal for aging. Sometimes it's the step before dementia called mild cognitive impairment, MCI, and sometimes it is dementia. But wherever your loved one lies, we meet you where you are, give you the resources that are appropriate for whatever stage of disease that you are looking at, and we walk with you. We usually have about follow-up appointments about every 6 months. If you're on the earlier end and you either just have normal memory loss for aging or mild cognitive impairment, we might say, we'll schedule you in a year, we'll call you to follow up, just to kind of track your overall trend of memory loss and what resources you need as caregivers. But we can also do follow-ups up to every month, 2 months, 3 months, if there's something sudden going on that we really need to address. So taking care of yourself, one of the things that I say often in that second appointment with the family summary conference is, if you don't take care of yourself, the wheels fall off and everything is deranged. So we encourage, I'm so glad to hear that with all of your knowledge that you are pursuing counseling. I also pursue counseling, and I have some personal experience, unfortunately, in my family with Parkinson's disease and dementia related to Parkinson's disease. So I too have a psychiatrist and a counselor that I see routinely, and we strongly recommend that for the caregivers. So 1 out of 3 people over the age of 80 will develop Alzheimer's type dementia. 1 out of 2 people over the age of 90. So basically, if you live long enough, the odds are stacked against you. So again, if you're not the ones requiring the caregiving, you will be providing it for somebody that you know and love.
Thank you. I had to step up here just for a minute. I want to thank Dr. Cribbs for acknowledging my SR. At the end of my name. Yeah, I appreciate that. I also want to be respectful of a lot of you who already know have some questions. So I just want to remind you, inside your bag, there's a journal and a pen in there. So you can write your notes down or information down, or if you got a question, because we're going to make sure we can hear from as many as you can, which means if we could ask the final 2 speakers to keep their remarks close to 5 minutes if we could. That way that'll allow time for you all. So I'm putting pressure on the last 2 to keep their remarks within that time period so we can allow you all to ask some questions too. Thank you.
Good morning. Am I on? No? Okay. My name is Denise Myricks. And I know people wonder what all those letters are behind my name. It just means I went to school for a long time. I am a nurse. I am a registered nurse. I'm also a clinical nurse specialist. I also have my doctorate in nursing. So I kind of feel like Giselle felt when I started taking care of my mom. I got all this knowledge. I can handle this. Wrong. There's just so much into that, and I can't tell you how many times her doctor would say to me, "What would you tell your patient? And what would you tell your patient's family?" And I'd be like, "Yeah, I know. It's a whole different ballgame when it's yours." It is. My mom passed away 2 years ago, 2 days before her 93rd birthday. The dementia started and it snuck up on us. I am the oldest of 5 girls. 3 of them have moved to Georgia. So it was just my one sister and I here. And little things Mom would say and we'd go, "What?" You got used to them repeating and you just didn't, She told me that before, it's okay. But then she started complaining of her belly hurting. And we started checking the refrigerator. Well, no wonder your belly hurts. She would heat up stuff over and over and over, and that wasn't my mom. So we tried independent living with some extra care. Then we tried assisted living. But when it got to the point that they were calling one or both of myself or my sister every day, your mama's waiting on you to come pick her up, we just brought her home. So fortunately, I had retired. My house is all on one floor, so it worked out well having Mom. We had to do different things at the house, like put a door alarm on the door because she was gonna walk home. My dog became her bodyguard, and she loved sitting on the front porch, but because I couldn't trust her, the dog's job was to let me know if Grandma got up. And he was very good at it. You know, you think you got it. You don't, and you will never have it. And even after you are no longer a caregiver for that person, part of you is still gonna wonder, if I had done X, Y, Z, would that have made a difference? Now I'm taking care of my husband. Trust me, he's 10 times harder than my mom. But, it's a labor of love. And somebody asked me, what do I do? And I told them, the shower has become my best friend. That's where I cry. And nobody has to know it except the dog. But you have got to let that out. I have begun to journal because some things you want to put on paper. I had an elderly lady tell me one time, you write letters to yourself or you write it in a book, and some pages you wouldn't want anybody to read. And I remember thinking, that's the dumbest thing I ever heard of. I got it. So, just think about it. There is no easy way. There is no way to prepare you for being a caregiver. There's no class. I looked online. No such thing. You just do what you can do. You find the resources that you have and let them help you. Okay?
Ditto. So much has been shared. I want to start first with what I do professionally. I'm a psychologist. I have a private practice. It's Christian-based. And then some of my own personal part of this. Psychologists have primarily 2 roles. One is to treat, the other is to evaluate, and often they overlap. A lot of people that I've had to deal with in terms of caregiving, they're looking for their loved one to be evaluated. What should I do? My husband is this, my wife is that, so on and so forth. So trying to get at what might be going on, whether it's diet, whether it's medication, whether it's genetic, those sorts of things have to come across so that the family understands that this is not because they don't like you anymore. This is because they have an illness, and no matter who was in the room, they'd be doing and saying the very same thing. So please don't personalize how your loved one is behaving. That's hard to do. because you live with them, and when they do it within their character, so you think, oh yeah. But when you can start to realize that this is the illness that's going on, and I can look at it from that perspective, it can help you to just kind of pull back a little bit and not be so hurt by their behavior. In terms of treatment, usually when I'm working with someone who has some form of illness, and I say that broadly because we've been talking a lot about dementia, Alzheimer's, that sort of thing, but young people also can develop some kind of debilitating illness or disease that calls for caregiving, even though they may be in their 20s. I have a new patient. He's 18 years old. He's argumentative with his mother, so on and so forth. This kid plays football. He's had 3 concussions. His behavior is really tied to the concussions, not because he's just an adolescent pissing off his mom. Oh, excuse me, I'm sorry. So when she started to realize that he is going to be referred to a neurologist to get further evaluated, but I do believe the concussions are what's the main factor in his behavior. So getting that kind of understanding can help you in terms of working with your loved one. But don't only think that people in their 90s or 80s behave this way. It can happen in a very young population as well, okay? So in treating this young man, I have his mom in the room, and when I started talking with her about what's going on with him, he started getting it, and started realizing that I'm not doing, now he's normally an AB student, but his English was dropping. And that's because he really has trouble with comprehension, analysis, those kinds of skills that he needs to have. So he's starting to catch on as I talk to his mom. If I talk to him directly, which I do that too, but he can start to even separate the disease from who he is as a person and realize this is me behaving this way because of that. So it's very important to identify what is going on, both for the patient and for the family member. And I guess that's a lot of what I do when I have various patients. Now, as caregiver, we have 2 daughters. When I came home from work, after my wife had had our 2nd child, she was sitting in the recliner and she couldn't get up. What's going on? My wife was diagnosed early with lupus. Little did we know, about 15 years later, they had misdiagnosed her. She really had psoriatic arthritis. And that's another thing you have to deal with, is that sometimes the diagnosis that are being given to your loved one is not the right one, okay? But early on in our marriage, I became a caregiver in terms of when we traveled, doing things, because there'd be days she couldn't quite get out of bed and do anything. So I had to, take care of those sorts of things. And you realize that we talk about, oh, I love the day, I love the ice cream, but when you talk about loving someone, that's an action verb. That doing and helping, caring for your loved one shows that you do love them and you do understand what this is really all about in this relationship. That my commitment is to be a help to them and to get them through difficult times. So there's that. My wife died 3 years ago, and she died suddenly. There wasn't any lengthy thing. There is one thing, you talk about something I should have done. She died of a brain aneurysm. But about a month or so before that, I would share with her something she had shared with me. And she says, "Where'd you find that out?" I says, "You told me that." I didn't think about it, that might be something else is going on. My wife's a very sharp woman, all that sort of thing, bright. And for her not to recall something she told me was kind of odd. Those little things. And in fact, at our next doctor's visit, We were going to have both of us screened, cognitively, but she died before that happened. So you do think, what did I miss? What could I have done? But they kept telling me there's nothing you could have done. No way could have known this is what was going on, other than thinking she was just a bit absent-minded. So the thing about it is that at the time that she passed, a very dear friend of mine had passed a year before. And so I married again this past July and ended up marrying the widow of my best friend. And it's interesting because now we're looking very deliberately about end-of-life issues, having lost both of our spouses in different ways. His illness was over a period of time. My wife's was suddenly. So I guess my message to you is that, first, I know you're here because you are already caregivers, or you understand that you need to provide caregiving. And Giselle talked about self-care, which is very important, but understand that self-care also needs to include, what about my end of life? Okay? Have I made plans? Have I done all those legal document kind of things? Have I looked at what kind of services I might need, because you may go quickly or you may be long-term. Things like, if I do develop dementia, what kind of things should be in place? Should I have an alarm on the door? My son-in-law's grandmother, when she developed dementia, I mean, somewhat funny, but not. I mean, she never went to sleep. She was up 24/7. So when my daughter and my son would go visit them, they had to keep their luggage in the car, because in the middle of the night, she'd come in and pull the slippers out of here and put them over there, and all that kind of stuff. She ended up being outside in the backyard, not fully dressed. So those kind of things were going on, and it was just very, very stressful. But knowing that you might be in that place, you may not think I'm going to be there, but you just might be. So take care of yourself, not just in terms of being well, in terms of taking care of your loved one, but take care of yourself in terms of what's going to happen toward the end of your life. My wife and I, we actually are very deliberate about some things now that we weren't before. Who's going to have custody, not custody, but who's going to handle our estate, that sort of thing, where we're going to live. All that has come into play in terms of the planning. Even though we've been married for 2 months now, honey? Yes. But that's my message to you, that you do that. I think my time is up.
I don't know about you, but I was taking some notes while I was sitting there. So if you don't have any questions, I got some questions I could definitely ask. So again, microphones on my left, your right, on each side, and there's also one in the center. I know you've got something based on, we heard preparation. And these are experts, and they're saying I wasn't prepared. We talked about self-care. Well, what does that look like? Do you have questions around that? The legal aspect of it. So we brought them in here for a reason, to answer some of the questions you may have. And this is not, look, remember in school, at the end of the class, the teacher would go, does anybody have any questions? And we just kind of look down. No, we just want to get out of here. This is not the time for that. So if you have a question, step to the mic. We'll acknowledge you. And we've got some experts here that would love to address those for you. Who's first? And then introduce yourself and then ask your question.
Hi, my name is Bernice Lachey, and I have a question for Dr. Sanders. You were saying not to personalize things, that sometimes it's the disease, but how do you know when it's the disease and when it's the person, their personality? For example, the person I take care of, he's the only boy in a group of 5 children, and he's been pampered and sheltered all his life, and he's kind of a chauvinist. But when there are some things that I think he ought to be able to do, he seems like he can't. Is that the disease, or is that he just doesn't want to do it?
How old is he?
76.
You've had him evaluated?
Yes, he has Alzheimer's.
I'm sorry.
He has dementia Alzheimer's.
Okay. I'm not sure. Have you had a family intervention with him?
Not an intervention, no.
You know,
He
I'm
knows
having-
he has the disease.
Okay, I'm having trouble hearing because the monitors aren't on here.
Can you speak a little louder?
Sure.
Yeah, we can't hear because it's like an echo chamber. Can we get the monitors on up here?
They're coming now. JR, Junior. Yeah. Repeat her question? Yeah, so we can respond. Okay. Well, the question basically, she was asking, how do I know if the behavior of this person is
Is the disease,
from the disease, or is
Or-
it just a personality trait?
yes,
Is that what I'm hearing?
right.
Yeah.
Do I sort of try to encourage him or insist that he do something, or is it the disease and he really can't do it?
There is a blend, if you will, going on because they will express the disease through their personality. Okay. But if you are communicating with him and he says he cannot, then you have to take him at his word. And that might be inconsistent. Yesterday he could, today he can't, tomorrow he can. But yeah, it's like I said, you tend to want to personalize it, but no one wants to be ill.
Right.
And they want to be able to do. So when they say they can't, you have to take them for that.
Believe it.
And make accommodations accordingly. Okay? Yeah.
Yeah.
Thank
Did
you for
anybody else
turning
want
on
to
it.
pick up on that? Go ahead.
My mother was initially, when I took her for her initial diagnosis, it was with Summa Center for Senior Health, and they are wonderful. They are absolutely wonderful in terms of what our expert here said. I don't know your name. That what you said, they are absolutely wonderful in that diagnosis. Even with that, it was still difficult, and it is difficult to know what is going on with my mother's dementia, what is a part of her personality, how do you cope with that, and how do you work with them with that. I think you have to be present. I think you can't necessarily think about you can know that the diagnosis is there, but you have to deal with the behavior that's there in front of you right there in the moment.
Okay.
And you have to be able to set aside what you're gonna have some personal feelings. I definitely have some personal feelings about my mama. We've had a long relationship, good and bad, but you have to try to be real present with them
Okay.
and deal with what that problem is in that moment. And they may be able to deal with it, they may not. And then you have to learn how to just let that go. It's a difficult process, but that's what's worked for me.
Thank you.
And they may get upset with you, but that's just part of the process.
Thank you both.
Thank you. Next. We on over there?
Hello? Okay. Hi, my name is Gina. My mother, this process started in the end of June. She had a heart attack. And then 2 weeks after that, she had a stroke. She had no symptoms of the heart attack. So, I was floored. I wasn't, and I'm still not sure how to, because everything happened so fast. I'm not sure how to. I don't understand. I mean, I don't get how. I'm sorry. The whole one, make time for yourself, take care of yourself. Because if I'm not with her, I feel extremely guilty about leaving her. Because we've always been so close. She is legitimately my best friend.
So the question I'm hearing is, how do you balance the self-care, taking care of myself, but
And how do I make?
I feel guilty
How
taking
do I
time.
make it okay?
Yeah,
I mean, how do I? I mean, that may be stupid.
No,
But I'm like right now. Yesterday when I told her I'm not coming to see you today because I'm doing A and B, and she gave me this look like, you're leaving me. You're not coming. I feel guilty. I don't.
Yeah.
I'm going
Who wants to take that? Go ahead.
I'll take that on. I understand you, I hear you, and I feel you. I was my mother's only child, and when I brought her up here, I was a primary caregiver. And so she gave me those same words, but I knew that I had to have some time for myself because I was going to crash and burn as well. And so that's when I said, find you some good people. And then I would tell her, Mom, I'm going to go for a walk for 45 minutes. And sometimes I would have to show her on the clock. And I would either have my son, or I'd have a friend, or I'd have someone to come and sit with her for a short period of time. Because for me, even though I had things in place, she always wanted me. She always wanted me to give her breakfast. She always wanted me to give her a bath. She wanted me to sit and watch Jeopardy and Wheel of Fortune. She wanted me to sit there and watch her sleep, which I did. However, it was a hardship. I'd do it all over again, but also I realized that I needed to have some time for me as well. So that's when I also, I got different services involved, and she kicking and screaming, but I had pastoral care come, physical therapy come. Even when the mobile meals lady came, it was just someone to give a break. So even if it's 15 minutes or 20 minutes or going to the grocery store and just like she's going in the shower and scream, I can't tell you how many times I went to the backyard and just screamed, because you're human and I get it, and you do not want to miss that opportunity. But you have to incorporate some self-care, even if it's just taking a bath for 20 minutes, because you will make yourself ill by trying to burn a candle at both ends. And that's just from my own personal experience, because I remember, actually feeling ill, but thinking I was okay, and I wasn't. And I understand, and I hear you with I understand and I get it. And my mom, she would not eat. She would do things intentionally because I wasn't there. And so sometimes I'm like, again, was it the disease or that was her control? And then sometimes, I was told I was the worst daughter, I didn't love her anymore, or anything like that. But I said, sometimes, Mom, I just need 10 minutes for myself. But that was my experience.
Also, the word I'm going to use is structure. When you say, I'm going to go and do such and such, let her know I'm going to be back in 15 minutes or at 2:30, so that she doesn't think you're leaving her, but she understands you're going to be back at a certain time. She wants you to watch a show. Mom, I can watch about 20 minutes, then I have to go do something. So she knows you're going to still be there, but she also knows that you've got other things you're going to do, but you're still going to come back. So with that structure, it can help her and help you.
She's
in
at
terms
a
of that.
rehab facility. So, like at the end of the night, when I'm ready to leave, she'll guilt me into staying a little bit longer. Or like if I miss a day when I come in, she'll go, "Who are you?" "I used to love somebody that looked like you." I mean, and I know that she's joking, but that hurts my heart.
I have to ask you something. Before she became ill, did she engage in some of those behaviors even back then? No?
My mom was this very strong, independent, I take care of everybody. Because professionally, she was a nurse. She was a NICU nurse for 30 years. So she took care of everybody. She took care, once, she started aging, I started taking care of her, but this one just kind of all happened at one time. And I do have an amazing support system. My church family is amazing. And when I call, they come.
She's afraid.
She's what?
She's afraid.
Oh, yeah.
Okay.
Okay.
And what she's doing out of fear. She's guilting you, but understand the motivating issue is that I'm afraid. That's why I'm saying and doing this. So if you can reassure her, Mom, I know you're afraid, but it's okay. And use that term, Mama, no need to be afraid. No, I'm here. So keep reminding her that as you're afraid, Mom, please understand we are still here caring for you. And then she starts to realize, yeah, I guess I am afraid, and that's why I'm doing this. Hopefully that may tone down some of her guilting, but when she does guilt you, you come back with, Mom, there's no need to be afraid.
Okay. Thank you.
I just want to add real quickly before you go. You're experiencing grief, and grief comes in many forms. And I think as you navigate this with your mom, I think that you have a support system, you might want to think about getting some counseling just for yourself in order to deal with that daily grief. Dan offered you some real good suggestions, but if you can have that ongoing support once a week, every 2 weeks, I think that will help you tremendously in terms of navigating your relationship with your mom. It's just recommended because it is grief.
Thank you.
Thank you. Sister Smith?
I'm Barbara Thornton Smith. Can you hear me?
Mm-hmm.
Okay. My question is, first I want to thank God for the 2 daughters that I have. Takes care of me every day.
Stay for the night.
Okay. I pretty much take care of myself every day. Last December I had surgery, and as a result of that surgery I had some serious medical emergencies that took me out of here for a while. So I was in and out of nursing facilities. But I'm back on my feet again. I'm thanking God for that. Now what my question is, I can take care of myself. I take care of all of my family, all of my household things, all of my bills and everything. But I have one thing, I take care of the Bible study every Friday. I'm good at that, I think. I thank God for it because we have quite a few people on every Friday. But I have a brain freeze every now and then. That's what I'm concerned about. I know it myself because I want to think of a restaurant, or I want to think, I want to think of a word, and I have a complete brain freeze, and I can't remember what it is. Now, tell me where I'm at. I'm 84 years old, and I'm watching what I'm doing myself.
If I could take this, I'll be the first, and maybe a couple others can chime in. So what we look for as physicians is, are these memory lapses negatively impacting your everyday life? The first things that tend to be impacted or difficult for patients who are suffering from dementia tend to be those that you learn later in life. Managing your finances, managing your medications, getting them filled on time, getting them in the pill organizing box, taking them at the right times. Are you managing your transportation and your meals? And those are the things that we look at. So are you doing all of those things?
Well, I can drive, but I'm not allowed right now.
I'm thankful that you are up and that you are well and that you are here, and thank you for sharing your experience.
I can take care of my medicine. I can take care of pretty much everything in my household.
Okay.
The only thing I was concerned about is this memory lapse that I have.
So what I often talk with my patients, and even my dad who's only 72, he jokingly says, so my daughter works on Alzheimer's, but I just have half-Zimers. And he says, you know, I liken it to a Rolodex, you know, the old Rolodexes that you could look at different people's information and get their phone numbers. As you get older, your experiences, the words that you have learned, all of those go into a mental Rolodex. So it's absolutely normal as you get older, even people in their 50s, 60s, 70s, and now you're in your 80s, to take a minute for the brain to be able to recall through all of the experiences, words you've ever learned, to get back that one word that you're trying to search for. So a couple tips that we usually have, and we have speech therapists that are phenomenal about this, is if you can't quite remember that word, if it's a place, describe other things around that place. If it's a person, describe other people who know that person. To be able to describe to whoever you're speaking with that word that just isn't coming out. Because if your brain, if you try to figure out that exact word, it'll be a brain freeze and you won't be able to bring it back. So describe around it if you can. Otherwise, let it go.
Well, that's good because I do that.
Yeah, there you go.
Thank you.
Yeah,
Thank you very
absolutely.
much.
So as long as your short-term memory is not impacting your everyday life,
No.
then you do not have dementia.
Who else? Are you? Go. We'll get you next. And this lady, then you. Okay.
Good morning. I'm Minister Pat Reese from the House of the Lord. Thank you for having this seminar. I have two questions. The first one is, I have a brother who's in a nursing home, and we have had a very tumultuous relationship growing up. And there are times I feel guilty because in my mind I said, you should be going to the nursing home X amount of times. You should be. And then the other part of me is saying, that relationship that you have with him won't allow that at this time. You're doing good to go once a month. Wanted to share that, to get your comments on that. And secondly, is there ever a time when you look at yourself and you say, I don't have what it takes to be a caregiver?
I will say this with regards to nursing homes, and there is a labor shortage in nursing homes, and so to find a nursing home that really is meeting your needs is hard. But one thing that does help is that when the staff sees that there's people coming to visit the patient on a regular basis, it really creates a connection with the staff, and that patient gets better care. So when you go visit your family member, you may only spend 2 minutes talking to him, but most of your time is spent talking to the staff, saying, how's he doing, what's going on? So your relationship with your brother may not change, but in terms of trying to see that he gets the best care possible, that's you visiting, talking with the staff, the nurses, et cetera, and then just checking in with him. but you're not going in to hang out, hey, what's going on? That's not what's happening. So when you can switch to that mindset, I think it might help you. As far as how often, it depends on your schedule, but don't feel like to sit there for an hour, okay? It may only be a 15-minute visit, but at least you came, you spoke to him, spoke to staff, and you're on your way. Does that help?
It does help. Sometimes I feel that caregiving can be like crucifixion.
You know,
You have to be, you gotta say, God.
Go ahead.
the other thing I wanted to add to that is, you know, when you go visit your loved one in the nursing home, you don't have to spend all your time in the room with them. Sometimes you should walk around and see what they're doing. What activities are the other people doing? He could do that. Or what is going on in how clean is it? What decorations are there? What pictures? Are they stimulating him? And it may take you 45 minutes to do all that. And you only spend 15 minutes with him. Okay, you spent an hour. But that is caregiving, because you are making sure that he's getting the best care. So please don't think that because I don't sit by your side for an hour that I'm not doing. Yes, you are. Yeah, you are.
Thank you.
About the staffing shortages at the assisted living facilities, the long-term care facilities, even the skilled nursing facilities with rehabs. And there is it's called an ombudsman, and I don't know if you guys have ever been introduced to this, but even if you can't remember this silly sounding word, if you talk with the social worker or transitional care coordinator at any of these places and say, I heard somebody tell me one time that there's somebody out there who can advocate for better care for my loved one, they will say, oh, that's the ombudsman. And now you've heard the word and you can recognize it if somebody else says it. If you're concerned, as a physician who goes to a lot of these different places, and we don't have direct ties. I'm part of SUMA and the house calls program at SUMA, and I don't have direct ties with any of these places. There's no monetary compensation or anything like this. So I am an unbiased type of care provider that if I see their trash hasn't been emptied for a week, or they're in the same diaper at 8 p.m. at night that they were at 8 in the morning, there has been no diaper change or incontinence pads changed, I will personally first go to the director of nursing, because that's your first chain of command if you feel that your loved one is not getting standard of care. And then if you've voiced it to the director of nursing at that facility and it still does not resolve, you go the next step, which is that ombudsman. And again, talking with the social worker, the nurse, the transitional care coordinator at these places, they will be able to put you into contact so to either file a written complaint or call in to speak with somebody so that you can advocate for better care for your family.
Thank you, I appreciate that. I want someone to address when you look at it and say, I do not have what it takes to be a caregiver.
Caregiving is a process. So for me, and I grew up being a caregiver, that's why I'm a clinical social worker, that I thought that, I would always be in that position of being a good caregiver. But I think when you're navigating this care of the person that you love, and when I was navigating that with my mom, there did come a time where I felt that it was just too much for me. Trying to navigate, I have a new husband, I was in clinical practice myself, so I'm working. She had a number of different issues, and I just started questioning myself as to whether I could really take care of her. And in the decision of placing her at that time in assisted living, I was being her best caregiver. At that time, I didn't understand it, and I was really torn by that because I should be able to do the job. But, you know, as you're doing this, you have to navigate what that job really looks like. So you might not be able to do the things at that time that she needed, and I wasn't able to do those things at that time. And when I placed her, that was the best decision I ever made because it just changed her quality of life to be amongst other people her age. She started doing the things that she was refusing to do in terms of her rehab. She was walking more. She was more engaged. She came out of her depression. So in my giving up that caretaking role, ended up being the best decision, and I was her caretaker. So caretaking is a real process, and you have to be able to say to yourself and learn how to take care of yourself and know when I can't do it and I need some. You got to acknowledge that. I can't do it and I need some help, and what that looks like.
On that same note, what we're expounding on is that caregiving is not one single kind of thing. It's such a broad range of things. You might have a family member that says, look, I'll pay for the help to come in. I'm not going to go see mom, but I'll pay for it. Someone else said, I'll handle the legal affairs. Someone else will be looking into the proper place for them to stay. All of those are caregiving behaviors. You do not have to be doing all of those things, but you might find other family members, and as important, the agencies that are here. When you contact those agencies, they can then assist you in the caregiving, and they will provide the kind of information and services that you need. So don't feel like I gotta do it all, okay? Look for other sources, resources, family members that can do different parts of the caregiving.
From my perspective as well, I felt that I had to do it all. And it was nothing but the Lord. It was one night I awakened and I thought I had my mom secure in the bed, and she had some dementia as well. She had gotten out of the bed, had a bunch of clothes on her, and the sheets were around her feet. And had I not awakened at that time, she would have fallen down the steps. But I felt that I had to do it all, and that's when I realized I had to place her in a facility also because I needed help. So that's where I utilized my resources, and my mom, like hers as well, she thrived when she went to the nursing home. As far as there were other people her age, they put her with the non-eaters, and so with her bossy self, she encouraged the non-eaters to eat. I was able, she got her nails done on Thursday, she got a shampoo on, so there were different activities that she was able to thrive, and that's where I had to surrender that I did not have to do it all by myself. So it was a great balance for our entire family.
We have time for two more questions. We got this young lady here.
Yes, I
well,
can't.
3, 1, 2, and 3, and 4.
Okay. I can't stand up because I have a bad back. Well, first of all, I want to thank all the professionals for your information. And that's because I was a nurse's assistant for 35 years. And they didn't have the technology that they have today. You know, that's one thing I wanted to say. But my children, which is 34 and 40, they live in Cleveland, I live here. But they're starting to experience with their father falling, memory loss, and I have some kind of information for them or resources, but they are full of fear. Mom, wonder if we come home and he have passed away, what we're going to do, or if he did this. And also he has seizures. So I wanted to know from the social worker the concern of my children, because I can't be there every day. what do they do? Do they start with the doctors and then go forth to get the information that they need? Thank you.
In Cleveland, I don't know if they have the similar type of resources, but this doctor here and their agency, they are a wonderful resource in terms of that beginning stage of getting your children's father the diagnoses they need and those initial supports that he may need. So to be able to tell your children to connect to a resource such as Summa Center for Senior Health, that will be an important beginning in terms of them being able to get some of the resources that are available there in Cleveland, as well as to get the support that they need in order to navigate how they're going to help their father. So I would really encourage, I don't know how much they have done that, but I think if you can get a place that's centralized just as this place is, they're going to give them a lot more access to the things that they need to get the support from themselves. And then secondly, I'm just, I'm a counselor. I recommend the counseling. Counseling can just provide just lots of resources for them to go together and see a counselor together. And there are lots of African-American counselors in the Cleveland area. I belong to a practice that's primarily African-American and Christian. So those are resources there that might be able to be of some help to you in terms of just that counseling piece, and they might have some expertise with geriatrics. So that's where I would start with your adult children.
Okay. Now, they do, because they're from Cleveland Clinic. He has Cleveland Clinic. So Cleveland Clinic got a lot of things. Right. So for them to talk with the doctor, they need to, that's where we start. I'm talking to the doctor here. Where do they start?
Exactly. They can actually start by calling in to the phone number that ends in 4100. Again, I'll have some cards with our office phone number. They don't need a referral from anyone, and we accept most insurances. And even if we don't accept your children's father's insurance for whatever reason, we then have a sliding scale payment plan that we can do. But ultimately, we accept most insurances. There were two things that came to mind that are important that we often recommend. In the time that they are waiting to be seen by the physician and social work, and again, physician and social work go hand in hand. We see them, both of us see each patient each time. And so two things I would recommend is maybe a falls detection bracelet. So even if that person has a seizure and they go down and no one is around them, they have what are called falls detection bracelets that sense when somebody has fallen and then go the extra step to notify emergency personnel. There are also the life alerts or the emergency response systems, but that requires an action on the person who's wearing it or somebody around them to notice that something has gone down and to press the button to activate emergency resources. So while I like those, if they fall and hit their head and they're passed out, they're not going to be able to press that button on their own. So the falls detection bracelets, and shoot, there was one, if they have any type of like nanny cams or things that you can link to be able, you said I can't be there all the time. Many of our patients are well enough to be left at home for a couple hours at a time, and their families choose to put in cameras, not in the sensitive areas, not in the bedroom, not in the bathroom, but just to oversee the kitchen, the living room, the hallway of the bathroom, so that if you can't physically be there, you can at least look on your mobile device and say, oh, is this person down? Have they fallen? Do I need to get help?
Okay, thank you guys.
No, on that same note, in terms of the nanny cam, you can set the nanny cam so it only shows at this level, okay? So it only picks up the person if they've fallen. Otherwise, you're not seeing above the knees. I had a patient whose mom needed that, and she said, I don't want to see mom. Of course not. Put it at that level, and so you're only going to see mom's legs at best. So you can set that kind of technology up. And also, there's so much other technology out there that I think if you look into it, you'll find there are ways that you can know what's going on with your loved one. My mother did use the fall thing, and I think it made a lot of difference in terms of feeling comfortable about your loved one living alone. I did brought in a handout. The Ohio Department of Aging has a department called Passport. It's another resource that will broker you into other agencies that may help you. That's all.
My name is Rachel Gordon. I took care of my mom for a little over 4 years before her passing, and I enjoyed every moment of it. The good, the bad, I enjoyed every moment. It was a lot of tears, it was a lot of smiles, but I enjoyed every moment. I'm taking care of my brother now, who came along with my mom. And since my mom, I said, of the passing, the responsibility has fallen on me. And again, I enjoy it. When I take them to the stores, I put a plan together Monday and Fridays. We do all the shopping. We want to go out to eat. We do everything on Mondays and Fridays. Tuesday, Wednesday, and Thursday, I clean up his house, make up his bed, change his linen, whatever. And I do enjoy it. It's a lot of responsibility. Sometimes I get in my car and I cry, but I love it. My question is, he doesn't take a heave on anything he does wrong. If we go out of town and he have an accident or something, it's someone else's fault. Changing his eating habits is someone else's fault. I told him he needs to speak to a nutritionist to say, how can we do this together? And we will do it together. We'll walk together. We'll do everything together. But he won't change. And he's always saying, well, it's this person, it's that person. He's able to clean up. He's able to make his own bed. He's able to do everything. He's a very bright young man, but he just got some little disability problems. And he won't take heed or ownership or anything wrong. How can I change his thinking so I can change my thinking and I can stop doing everything and allow him to start taking a little responsibility if he clean up the living room, if he take his linen off his own bed? How can I have him do that? I mean, he pays me, and the money doesn't even bother him. I don't care about the money. I just care about him now taking some responsibilities on himself, within himself. And Bentley, the first lady, the first doctor, yes, I really enjoyed everyone, but your social worker, I'm sorry. Your lifestyle with your mom was just like mine, and I enjoyed it. I really enjoyed being with my mother. I miss her dearly, but I really, really enjoyed taking care of my mother. Now, again, I'm taking care of my brother, but where my mom took responsibilities on her actions, he's not taking absolutely no responsibility on his actions. So how can I change my thinking to help him change his?
A hard reality is that, is this person competent or not?
He's very much competent.
Meaning they are considered to be able to make a decision for themselves. They can make choices. And some people make bad choices. And there's not much you can do about that. I've got a client whose brother's in a nursing home, and all he wants is burgers and fries, okay? He's getting big as a house. He don't care. He won't go to physical therapy, none of that. He is having a slow death, okay? And they've talked to him. But no, he won't change his mind until they can show that he's no longer able to make rash decisions anymore. There's not much they can do. So it's unfortunate, but that's a reality that you have to come to grips with, is that they are making choices that you wouldn't make, but You can't change that. I'm sorry. I wish it were different.
You know, we all come into this world with personalities. God gives us personalities. They're influenced by our environment and how we grow up. But there's that core personality. And I think that what you have to come to grips with is that this is who my brother is. So what do I do so that I am in the position that I am taking care of myself the best way? Because he's not going to change. So what changes do I need to make so that I'm surviving this in the best way that I can survive it? And when you take that approach and decide what you can do and to come to grips with the fact that he's not going to do it, then you're going to be able to live much better with him. As long as you're struggling with how can I get him to change, how can I get him to change, you're going to keep struggling. He is who he is, and it's about what can I do to make things best for me as I take care of him.
First, I want to give honor to God for allowing us to wake up this morning and to be here. And I thank all of you. I know the importance of the caregiving, so I thank you all for serving what God has you to do. But here's my question. My mother will be 90 in January. She lives with me, and I take care of her. I have guardianship over my mother. I also have a husband who's been sick. So not only did I have my mom, but I care for bed 1 and bed 2 at the same time. What I'm trying to find is peace between the siblings. They have a lot to say, the siblings, the sisters. I'm the oldest girl. My brother is MRDD. And I'm having difficulties outside of taking care of my mother. How do you find the peace with the siblings that want to give outside help or information and they're not there to assist? That is my difficulty, and there's 5 of us. A lot of times I have to step back and say, this week I'm taking off. Either she goes to respite or somebody step in. Sometimes you gotta meet the Jesus mat with them and ask them to help, or they're not going to. But the bickering and the interfering, how do you manage that when there's other siblings involved? That's my question.
As I said, I'm the oldest of 5 girls. 3 of my sisters live in Georgia, and one particular was your relative. Everybody got one. But she would call and say, I'm sending money for mom to XYZ. Or why can't you take her to, and I said, well, why don't you come up here and stay with us for a week? And then you can see, her goal was to send, my mother, when she was in her right mind, loved those word finds. And she said, oh, I got the big letters for her. Ain't no matter. She's not there anymore to do that. But I needed her to come and spend the night at my house. It only took 2 days for her to realize where mom really was. As long as she's, because you know what, even my hubby, when they call him and say, how you feel? Oh, I'm pretty good. I'm thinking, you know, but who told you that? But in their mind, I mean, really, I just sometimes we come from the doctor and I think he comes back and tells his family, doctor said you do blah, 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 blah. And I'm like, what doctor did you go to that I missed? But, you know, in their mind, they're fine. You know, I mean, just like my mom, she's walking to home. We took her to adult daycare, and when you would go she did great there, actually. But when we would go pick her up, she'd say, wait a minute, I gotta give report. She was a nurse. She had to sign off and give report before she could leave. And the nurses just smiled and took report. You know, if you are dealing with that person, your loved one that's you're caregiving for, you don't have time for them to mess with you or mess with your routine. What I always said, I'm like you say, oh, come on up. Why don't you come on up? I'll bake you, da, 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 da. And let them come. And if they spend a couple of days in your shoes, you back off. Let them do it. They see a different picture. So that's usually the only way you're going to get them to see or stop interfering, because in their mind, that loved one is still where they were. Right. The last time I saw you, you were fine. You were driving. You were doing. That's what they still see. And you know, I mean, even when you're with them, it's hard for you to see what you're actually seeing. Because that's my mom. What? So, you know, the best thing that I found was having one or two of them come and stay with me for even a couple of hours. They can see the difference and find out that their remedy is not the best remedy. And that works.
That works if they're willing to come stay. And if they're able, I have many, many patients who have the person that is you with boots on the ground, on the battlefield, taking care, fierce, great care of their loved one. And then you have the person who lives out of state that is suffering, I think, their own personal form of guilt for not being physically there. So sometimes out of the best of intentions comes the worst harassment. And so we often just provide some counseling and encouragement to the people who are here, who are doing the work 24/7. And I'm so glad you mentioned respite care, that you are aware of those services. Adult Day Center, another really good, just to get an hour or 2, 3 of reprieve. But I would encourage you to have them in to physically see. But many patients, or the people who are out of state, out of town, to relieve some of their own guilt. They'll throw money at it. They'll throw words, very strong words at it. But the fact is that they're not here and they're not doing it. And you just have to thank the Lord that you are here, that you are able, that you are willing, that you are intelligent, and that you are doing the best that you can with the resources that you have.
Thank you.
Good morning. My name is Mary Anderson. Thank you for having this. Thank you for being my village. So I'm the adult child, just starting to mourn the changes that are happening. And I feel like I've been falling for the okie doke so much in this last 2 years. Because, you know, my mom and my dad, they're still here, thank God. And I have a brother who's there often. And he's there, he's on boots on the ground person. You know, I live 2 exits up, I have my own home, I'm working, and I'm working like a dog. I'm tired, and sometimes all I want to do is go home and go to sleep. And while all that is going on, I try to spend time at least once a month taking my mother out to breakfast and listening to her, and still listening to the things that she has to do as a wife. And I'm thinking, Mom, you retired. Why are you still doing these things, you know? But that's all she knows. The blessing is she's a seamstress. By the way, she has an annex of Joann fabric in her basement. And so those are her joys. My challenge is that each month I'm seeing something different. And it's hard to see. It really is. It's very, it's just, it is what it is. And I'm just learning to manage it the best way I can. And sometimes it's with tears. Sometimes it's with family. So now my issue is the guilt, because brother's there, you know, despite whatever circumstances he's in, he's there. And the nephews are there, they're all there, so they see what's going on, where I'm at home, I'm working, and I serve the public. So it's just that guilt that I feel. And I'm grateful for this, because I know I'm probably gonna need to talk to somebody, because I know there are a lot of cognitive changes. My questions are, because I know I need to go through the medical power of attorney thing with her, despite the fact that my father's there and he's there, you know, he calling sideline shots, but this is my mama. And she's been an amazing woman. And I couldn't live with myself if I didn't put things in place to make sure I'm doing what I can. I have time, there's been times she called me and I can leave work to go get to where she's at. She's having a breathing issue, so I'm grateful for that. But the medical part, the second part is the COPD. She has these breathing issues, and it's just weird. We don't know if it's asthma. I went to the doctor with her, and I still didn't get any answers. And sometimes when I go to the doctor, I'm just like, okay. I just go along with it. And then I feel like I didn't ask the right questions. And then I'm left feeling like, oh man, I didn't do what I needed to do to take care of my mom. So there's that. And then the last thing is, are there services, the house has changed. There's hoarding there. That's not the house that I grew up in, and I don't like going over there. And that's just this guilt thing that I play on myself when I go over there. Thank you for sharing about just going over there and sitting for 15 minutes, because I'm thinking it's quality over quantity. So thank you for sharing that. But those are my questions.
Speak to the healthcare power of attorney. There's also something called a financial power of attorney. There's also a durable general power of attorney. So there are lots of different terms that describe different documents. There's your living will, which is a medical document. There's also your will that you would, will whatever property or assets that you might have. Online, there is, I think the document is roughly 7 pages. Mm-hmm. If you go to just any search engine and type in Ohio power of attorney, healthcare power of attorney, that is paperwork that can actually be printed out, local library, work, wherever, if you don't have a printer at home. And that does not require anybody licensed to complete that. So basically, that healthcare power of attorney can be printed out and completed. It just has to be signed by either a public notary, which sometimes comes with a fee. So what we recommend for cheapest and the most direct way, I think you have to have either 1 or 2 witnesses sign that document after you've completed it. And what that document does is it says, here I am, let's say I'm Mary Smith, I'm the mother, and I want, Jackie and Jamie to be my number 1 and my number 2 contacts whenever there's a medical related emergency. If I can't speak for myself, I want Jackie number 1, Jamie number 2. I write those names down. Those people do not have to be present. It just has to be the person who is completing that power of attorney document. And then when they sign and date, and either 1 or 2 witnesses sign and date, those witnesses can be anybody that is not related by blood, marriage, or adoption. So you go to your neighbor across the street or beside you that is not related to you by blood, adoption, or marriage, and they can witness that, and that is a legal document that is standing that can be used in an emergency for healthcare at least. We recommend elder care services to complete a living will and to complete a financial power of attorney. And there are different people, Direction Home, which was referred to Passport Direction Home. They can be a resource for providing lists of elder care attorneys in the area, as can our office. But if you're looking for something just as a general rule. So I'll let somebody else take another.
I think it's time. I don't know if you sat down and talked to your mom about the changes you're seeing? So, I think if your mom's open to it, I think this wonderful staff right here is the first place to go.
Okay.
To get that initial assessment, for your mom to see where she's at physically and where you guys are at emotionally, and then they give you the resources that you need and a plan
Thank you.
on where to start. So I think that's what you need to do.
Thank you. Because neither one of them want me to bother them. They're still at that age. Like, I don't want to bother them. Please bother me, because I don't know what's going on unless you tell me. And now sometimes I have to be the voice for them. And so I do understand that. Thank you so much.
Let's give this panel a hand. The one thing I hope you took note of, they're people just like you. They've experienced things just like you. And the reason why I'm saying this is, when we break in a little bit for lunch, you'll be sitting with people just like you that have gone through these situations already, and that can advise you and inform you, or they may become the resource for you. So thank you so much for stepping forward. I knew I wouldn't have a problem. I didn't know if I was going to have to get the hook for a minute, but it's an emotional time. Emotional time. And one of the things I heard loud and clear is, don't be afraid to ask for help. Don't be afraid to ask for help. So,
nobody suffered quite like them. Nobody loves as much as them. I work with palliative docs. I'm fortunate enough to have fallen in love with a geriatrician. Pretty good thinking at my age. But I work with most palliative docs, and they run around thinking, hey, nobody cares like they care. Look, we don't need martyrdom. What we need is shared support, where we recognize that though we might be between worlds, we're going to hang on to that part of the world that says we care and love one another. We're going to take care of one another through it out. And that means saying, I got to tap out. That means saying, I need you to take somebody to do that. That means saying, just, can I bend your ear for half an hour? Whatever it is, you pay attention to you, you're going to find out what you need. It kind of creates, if we're not careful, false facades, which it leads to this, sorry, you forgive me, I work at a hospital, so everything's about infectious disease, blah, blah, blah. And I say that like it's not important. Of course it's important. Disease, who cares? No, but there's a kind of contagion that we can carry if we're not cautious, and it's the contagion of dissociation being perceived as strength, right? It's the contagion of further propagating this dysfunction, this maladaptive approach, and passing it on to our children. It's a type of generational learned experiences and traumas, or at least ways of dealing with broken hearts and trauma. It leads to this downward spiral that makes us prime, that makes our immune system open and prime to receive the virus of our world of escapism and imagining that everybody else has got it better or different. Everybody dies, everybody steps into eternity, everybody hurts and suffers, and everybody benefits from tender, loving kindness. Everybody does. And so what we do is we just try to be human to one another. We try and heal as we're going. Now, Sarah said at the beginning, she goes, oh, I don't know, I feel out of place up here. I said, you're out of place. When you work at a hospital, there's all kinds of people sit behind desks, sit in offices, know what we ought to be doing. But those that are doing it know what they ought to be doing it. If you're caregiving, you know what it's like. Please take care of yourself. Take good care of yourself. You're doing a type of loving that's incredibly difficult. And deep bow and respect for all of us that are trying to love each other well. Thank you.
Good afternoon. My name is Patricia Tislam, and I would like to read John chapter 21, verses 18. I tell you the truth. When you was young, you was able to do as you liked. You dressed yourself and went wherever you wanted to go. But when you're old, you will stretch out your hands, and others will dress you and take you where you don't want to go. I have been a caregiver for several people. Some of them had dementia. My focus will be on one particular person who had dementia. He was a person who believed and loved the Lord. Although dementia changed what he said and did at times, it did not change his true character. In talking with him, he will always, always remind you of the goodness of the Lord. As his dementia progressed, the things he used to do, he was not able to do anymore because of dementia and other health issues. For example, going for a walk around his neighborhood. He loved doing that every day, especially in the summertime. He would take off in the morning, take a walk, then in the afternoon, he would go take a walk. But since health and dementia stepped in, he was not able to do that anymore. Then he liked going down to Firestone High School baseball field and watch the baseball game. He loved doing that, but he was not able to do that anymore because of his health and dementia had set in. And he would tell stories about when he was in the Army. Although he would tell the same story over and over again, I will make it seem like I never heard that story before. Now, taking care of yourself is very important. Always pray to God about what you are and what you're going through. Always pray. Get enough rest and eat well. Exercise regularly. If you have a medical appointment for yourself or need to schedule an appointment for yourself, please make sure you keep the appointment. Making sure you are the best you can be will help you as you care for your loved one. As you're taking care of the person, seek and support yourself when you need it. Do not try to do everything yourself. If possible, arrange to take a day off or a week for yourself. Again, I would like to remind you, taking care of yourself is very important, because if you don't take care of yourself, no one else will. So be the best you can be. Thank you.
So let me first say thank you, Brother Marvin and Sister Michelle, for this great event. I just think that caregivers are often not seen in a world that they need to be seen in, because it's something that, you work on an island. Pretty much you feel like you're on an island alone. And just to be recognized and say that, hey, there's a whole group of us out there that are putting the work in every day, every hour. Thank you very much. And to the speakers this morning, wow. You guys were really great. You hit on so many great things that I hope we took notes along the way. When Sister Reba Fowler asked me to be on this panel as telling a testimony, I said, Sister Reba, I don't need to be on no panel. I don't know nothing about no caregiving. And she said, yes, you do. You got to be on the panel. And I said, okay, all right. And then when I walked in and I saw the theme, helping caregivers stand, it just really reminded me of where I was. I didn't understand any of that. I didn't know that I was a caregiver, because I was just doing what the Bible says and being a husband in sickness and in health. I was just doing what I was supposed to do as I thought as a husband. I didn't understand that I was a caregiver. And so in my wife's journey, 2010 is when she was diagnosed with breast cancer. And so that version of caregiving was she had a lumpectomy, and through that, it was just the surgery and all the things that comes with that and the healing process, and it was caregiving, and I didn't understand that that was caregiving. I was just doing what I thought I was supposed to do. And then she went about 4.5, almost 5 years, cancer-free, and in 2015, the cancer metastasized, and she went from the breast surgery. Then she had a lung cancer, still breast cancer, metastasized to her lung. And from that, they did a lung section where they cut out a part of your lung, and they told her you will never be able to breathe again like you have been used to. And for those of you who knew Dr. Swoop, don't tell her no. She was a woman of strong faith and just as strong in her constitution. So that meant the caregiving for me became helping her to, she had surgery that day, that morning, and that afternoon, we were walking the halls of the hospital. Because she immediately said, oh, I'm gonna have trouble breathing, I need to start working out more. So then it went from, so it was the breast cancer, the section of her lungs, then she had brain cancer. After the brain cancer, again, they said, well, you know, you're gonna, let me just stick this in here, miracle story. Because when they opened her up to do the brain, if you know anything about going in the brain, if it's intensive, it's gonna be some residual from that. When they opened up the brain, the tumor fell out. Immediately. The doctor said there was nothing for us to do other than, you know, check for a clean margin and all that stuff that comes with cancer. But the tumor fell out immediately. So we went through that surgery, and as caregiving, I walked through that again. And so that was the third surgery. The fourth cancer was skin cancer, which led to I don't want to get too technical, a special radiation, thermal radiation, where they had to heat the body up, and it's just very painful. And she walked through that. Most of the congregation didn't know that treatments were on Monday. So she would have the whole week to heal, because on the weekend, she started preparing for Sunday service. She was ready to go on Sunday, and then she went back to treatment on Monday. So you saw the best of Dr. Swoop, because she would not miss a Sunday, period. She worked hard that happened, but the rest of the week was all about caregiving and making those steps. And that left her with a large basketball-sized wound that had to be dressed at least 3 times a day. Well, I did that because I was a husband. That's what you're supposed to do. I didn't call it caregiving. I called it just being a husband. And then from that, it metastasized to her organs and so forth and so on. So there were 3 things that I kind of, hold on, technology, here we go. 3 things I learned in the process. There are different stages of caregiving. It can be as small as helping someone through surgery and heal, and as big as the 24/7 caregiving. In our case, it was a situation where medication started at 6, and they ended about midnight, and probably 1 or 2 o'clock is when I got her to bed, but I had to be up to start medications again at 6, and I was working. So it was nonstop. I didn't know that, I didn't know I needed to take time for myself, because it's what, in my mind, it's what a husband was supposed to do. So sometimes when you're a caregiver, you're in the forest, so you can't see the trees. And if you can't see the trees, you don't know what questions to ask. I didn't know what to ask. Even to the point that we had a situation when I was spinning all 6 saucers at the same time, and I was running and going and doing, and it was Dr. Swoop who said to me, "You need some help." And I said, I'm a man, I don't need no help. We know it all. And she said, "You need some help." And I pushed back, and she said, "I just need you to do one thing. Call Sister Monique Toppin and our connection group and tell her, I said, you need some help. And it wasn't until the help came that I realized I needed some help. I didn't know that that was a 24/7 situation, and I didn't know that I needed the help because I was doing so much. Again, a caregiver has to take care of themselves. And I think that's been a theme a lot for today. So the different stages of caregiving. I had to remember that the care that I was giving, this was a big one for me. The care that I was giving was not for me, because I wanted to give her the care that it was, I'm gonna do this just like I'm doing it for myself. I wanted to be right. But when I did it for myself, it wasn't always comfortable for her. So I had to change my thinking of what caregiving was to, I'm doing this for the person that has to be comfortable with it. So I had to understand that when I did things a certain way, it didn't have to be my way, it had to be her way. And, you know, Dr. Swoop clearly spoke her mind all the time. So if it wasn't right, I often knew it wasn't right, which leads to my third point. The level of frustration of the person that you're giving care to is going to change. And when it changes, they're going to often take that out on you, caregiver. And when they take that out on you, don't take it personal. Because we want to say, well, she don't appreciate it that I did this and I did that. That's what we want to say. But it was her own level of frustration, especially in my situation. I had a highly intelligent person who didn't want to be dependent. And she was at a place where she needed to be dependent. So when that frustration came my way, I had to say, this is not personal, keep doing your job. So that's where I ended up. I ended up that helping a caregiver to stand. I didn't know I was a caregiver. I didn't know I needed help. And I didn't know I needed help standing until I was about to fall. Take care of yourself.
Thank you, thank you. Just like we did this morning, I know something has already resonated in your head that you'd like to ask one of the speakers up here this afternoon. If you would move to my left, your right, or on this side or in the center, and step up to the mic. I know you got a question for this young lady. Someone's going to ask her something, I know for sure, as well as our chaplain. And I know I'm just waiting for somebody to stand up there. Go ahead, Michelle.
Just tell us how old you are, Sarah.
I'm 19.
But how old were you when you first started caregiving?
Okay, it's kind of unclear, like when I first started, because there's always been something, if that makes sense, or there's always been someone who needs help. Like, it didn't start, I'll say for me, it started with my granny just being a presence, you know. That was when I was 4. When I started doing things, I was like, 2019, like, somewhere around 2019, 2018, I was like 12, 13. And then when I started avidly caring for my auntie, because she has Parkinson's, for those of you who don't know her. No, I didn't say that, but I was around 14, 15. And then, yeah.
What that turkey starting to, you know, it's got that, what's it called? Yeah, turkey fan in it. Put y'all to sleep. Questions? Comments? Yes. What's your outlet?
I say it's a couple of different things. Like, I like just being able to see my mom smile. That really helps. Or being able to make people laugh, because when I'm not, ridiculously socially awkward, I do actually crack a joke here and there. So, I try. But I used to play the drums. I played the drums for like 3 years. Well, I played drum set for 3 years, but I started in like 2nd grade, so music was always an outlet. Hanging out with my friends, and it used to be the connection group here, the Wednesday night youth group, but now I work every Wednesday, so I can't, go anymore. So, yeah, but prayer for sure, because certain things you can't tell everybody. Like even when people have good intentions, nobody can help you like God can. So prayer a lot, and I used to go to therapy, but not really anymore. So I would definitely encourage that if you feel like you need it, though. Definitely good to let that out. But yeah, and hiking. I like to exercise when I can. So I like to go on hikes, yeah.
I got a question for all 4 of you. And one of the themes I've heard, hold on a second, I'll get you. One of the themes I've heard is when all else fails, and you may have been told this, we should rely on who? Yeah, and we know this, right? We all know this. But if God is not your anchor, then you're kind of drifting to the right, to the left, frontwards and backwards. So my question is, how do you stay anchored in the Lord? Because I think there's a lot of cliches we hear in church, right? Somebody wants to throw a Bible verse at you, or something that they heard that, but it's at the end of the day, it's just you. So if God is our anchor, I'd like to hear from all 4 of you, just for how do you stay anchored in the Lord during this time? Larry, you want to go first?
I will. I know for me, the anchor has been the Arlington Church of God. If you don't have a good resource around you, a good support system around you, you're going to be in trouble as a caregiver. Going through all of those different stages of caregiving, it was very helpful. I think we have probably the first class nurses ministry in the area. Sister Diane Reed and Michelle and Mary and Monique, I can name them, but I can't tell you how many phone calls that I made over little things that I don't understand the medical world. So those resources helped me to anchor who I was and what I was doing. Sister Mary has worked in hospice as an RN. So she had the whole hospice language and direction. So it was the church and the foundation and the support of the people around me to just help me to do what I did just a little bit better.
Okay.
I would say the same thing. I thank my sister Brenda and friends who helped me through the things that I was going through, taking care of loved ones. You can come back and I would talk to her about things that was going on. I try not to get angry because the people that you're taking care of, most time, they're not aware of what's going on themselves. They can make you angry by saying things to you, but you have to remember where they're at and where you are. You are the one taking care of them, and they have a problem, and they don't even realize it. So when I'm going through things, and I need someone to talk to, I always talk to the Lord first. That's my first thing. And then I call my sister. Thank you.
Yeah, so for me, my being anchored has much to do with my calling, what I feel like I'm called to be, what I'm supposed to be on planet Earth. And it's changed as life changes. But in about 2010, 2011, in our family, 2 of our grandchildren died within a year. And that's a little disorienting. And it'll change your trajectory. And one of the things I noticed, I was pastoring at the time, and one of the things I noticed is that on top of the suffering my sons and daughter-in-laws were experiencing, and me secondhand, differently, I guess, was the people don't know how to deal with that level of misfortune, and so they withdraw because they don't know what to say, right? So the suffering was worsened by this sort of having a pariah kind of feel. So I had heard about some training at the hospital, and I felt called and made a commitment to walk towards the suffering instead of away from it, to understand the wisdom of the sufferer, to see that suffering is an experience that if you stay in it long enough, or you adjust your eyes to the darkness, there's beauty everywhere. If I make my bed in hell, thou art there, the psalmist says. And so there's my anchor is my calling, and I establish my calling by practices. I do my calling first in the morning. Natalie and I will set our intentions. We got a list of what to do. That's not it. We ask ourselves, I ask myself, whom do I want to be while I'm doing my list of things? And that anchors me in my calling. I go back to the beginning and start again, sort of a new mind, new spirit, and say, all right, who am I going to be? How am I going to be today in this space?
I would say mine is a combination of kind of what everybody said, to a point to what Uncle Larry said. Definitely Arlington. Growing up here, everybody being like, oh, that's Dolly's daughter, you know. There's a reason why y'all know who my mom is, because she made herself apparent in the church, not just by singing in the choir, but by being kind, you know, and being a woman of God to everybody she meets, whether she knows you or not. Because there's a couple people, she'll probably, you know, hey, how you doing? I forgot your name, but, you know, how are you? But she'll still put her best foot forward, even in the times where there would be days where she would come to church, and immediately after the service is over, she got to take her shoes off because her feet are swollen, and she's got to go. Sorry if she sees this, I don't mean to put your business out there, but, you know, like, there are things that she would fight through because of her connection with this church, because of the people who were there for her, like Pastor Swoop. Because when Pastor Swoop was diagnosed 5 months after my granny died, my mom was diagnosed 6 months, so they were a month apart, and they were cancer buddies, for lack of a better term, but they would definitely fight together. And my mom, I can definitely say, is in the spirits that she's in because of having Dr. Swoop, and because of having her church family, Auntie Leslie, everybody here who would really put their best foot forward for one another, and having that sense of community. And then I would also say, being out in the world and seeing what it's like to not have God in your life. Because I'm not gonna sit here and pretend that just because I grew up in the church, that's the only place I'm ever at. You know, like, I've been to parties before, I've been to school, public schools, that's his own little world. But seeing people who did not have my upbringing and did not have God showed me that is not where I want to be at all. Because I've experienced, you know, I have anxiety, I have depression, I have mental stuff, you know, but I could not live a life without hope. I could not live a life without God, you know, because that's terrible. It really is. So being out and just being at work and being a blessing to other people, seeing that even when I'm not intentionally trying to be a disciple, God is working through me, even when, yes, I could be doing better. But just saying God bless you at the end of the day, and seeing people double take and being like, you know what, thank you. I actually really needed that right now. Just having that ground me, because sometimes you kind of anchor yourself by the little things. So yeah, just being able to be out and actively helping, or like in the hospital when there was somebody else who needed a nurse's attention, and you know, every place is understaffed, so just being able to help somebody else and them wondering like, what would make you want to reach out? And it's not necessarily me, it's just God working through me. So yeah, just acting out what he needs me to do, and then having a good foundation and having a good support. Like I said, family, you know, we get together and we pray, or we get together and we sing old hymns, stuff like that. Helps.
Thank you. Thank you. Go ahead, clap. Yeah. Pastor Tony Johnson stood up before he gave his intercessory prayer, probably, boy, it could be 3-4 years ago. But he read something before he went into prayer, and it was so impactful, I actually looked that little statement up and ordered on Amazon a sign that had that statement. And that sign has now been, and my wife knows it, it's in between my sink and her sink on the wall. So that's one of the first things I see every morning. And the sign says, "Good morning. This is God. I will be handling all your problems today, so you don't have to worry. Have a great day." If you put your trust in him and you believe what he says, I actually have a shirt that says, "Just do what Jesus says." I mean, it's simple, but it's tough sometimes because we get caught up in our emotions. But if you let God calm those emotions down, remember who's really in charge of today, boy, you can go about your day with a what? Big smile on your face every day, every day. So thank you for commenting on that. All right, who's? All right, that's how God works. Anybody else for the panel? Yes. Could you step up to the microphone?
To release and let you help them or give you control or to even assist them in anything they have going on.
Okay, the question was, how do you get strong, dominant, controlling personalities to let go so you can help them? I'm sure probably somebody worked with somebody like that, right, Larry?
I think Brother Dan, Dr. Dan answered that really well this morning. You're talking about the illness and the impact of the illness versus a personality, and understanding that sometimes that's not going to change if that's a personality. That's who they've been. With Dr. Swoop, she was a strong personality. I remember when I took over medications and if you know anything about pain medicines, that's a whole nother world unto itself. And you have to get in front of the pain and stay in front of the pain so that you don't want to get off schedule. And so when I had finally gotten, with all the changes from the doctors and this med, that med, and we finally got in front of the pain, and so I was really trying hard to stay on the medications. That meant that every 2 hours, something had to be administered. So every 2 hours, I came to her with something to be administered. Every 2 hours, she said the same thing. "What is this? What's the blue one for? What's the green one for?" So after doing that a few times, I would say, "No, I done told her 3 times what this medicine is for." But I realized that her personality and her intellect, she always wanted to know what was going in her body. This was her personality. What was going in her body, and that she was in charge of it. So that's, again, where I had to switch the type of caregiving that I was giving. And every 2 hours, I explained what I gave to her. Frustrating for me, but cathartic for her. So sometimes that personality is not going to change, and you have to ask the Lord, okay, help me with this. Personality versus the impact of the illness.
Yeah, I love that, by the way. That's good. I think we sometimes take words and put them in the same category, and they're a little bit different. So strong is a little different than dominant. Dominant's a little bit different than controlling. I think when you tease out the 3 aspects, what we find is sometimes controlling and dominant personalities, we attribute strength to them. It may be weakness. It may be they're punching first before, because they're self-protecting a wound or a hurt. So I just want to offer that up, that sometimes controlling and domination and that kind of stuff is a sign of weakness, from the standpoint that the scriptures teach that in my weakness is his strength made perfect. So to your point, though, we enter into their world, like we use Christ as the incarnate, his incarnation into our world is our work in theirs. To the degree that we can honor what their personalities are, we do it. If they start to be controlling and dominant and carrying on, the heart that says, man, this really matters to you. How can I help you? Like it's not a tug and war between wills. It is, how do we serve you, even in this condition, the best way?
I say to an extent, if it's something that you know needs done or something that you know that they would want done, but they're too prideful to say it or maybe just too stubborn, just do it. Just do it. Because what are they going to do? They're going to be glad that you did it. You know, like, it's not, you know, like, yeah, I'm not saying, like, don't force them to do something that they don't want to do. But if there's something that you know that there's something that needs, you know, assistance, just take control. Because that wondering of, should I step in? And then just having to watch somebody else do it, or just watching it not get done and being like, dang, like, probably should have did that. You know, that guilt is probably gonna eat at you more than it's done now, you know, because when you're dealing with an independence, you know, there's never gonna be a point in your life where you're like, oh, I'll just give up. I'll just let them do whatever needs done, because, you know, you never wanna not be in control. You never wanna be a burden, and that's kind of how people feel sometimes when they need that extra help. But the best way to not feel like a burden is for you to just do and them not have to ask, because sometimes that asking step doesn't come until they see, like, it's safe for me to just ask. I don't have to feel like I'm doing something bad or something negative by just asking for assistance. But that comes with time, and that comes with someone else taking control and taking those reins even when they're not trying to give them to you.
Let's give this panel a hand. Good job. Good job. Any closing remarks from anybody? Anybody want to say anything else before we? You good? Could somebody give him a microphone? Hold on, Brian.
Thank you. You know, this morning as I was listening, it was taking me back. I was telling someone that, I think it was Sister Smith, or Lorinda Irby, one of them two. I was renting a room in New York for $100 a week, a furnished room. And I only got there one time a week. That was to pay the rent. Because the other 6 days I stayed with my mother because she needed caregiving. And being that I was the baby, I did, as far as my brothers that never did any caregiving, all they could say is I did everything wrong. And it made me angry. Then I got a little older, and I wound up having to deal with a child that has an illness that when a crisis comes on, at that moment, my world had to stop. Everything had to deal with him. And then now, I'm on a rollator. And now he feels like he's got to be my caregiver. You know, and I tell him, look, dude, you can move out anytime you want. Get in and live life. I can't move out. I'm just worried about you. So how do I get my son to understand it's okay for him to live his life? Mm. And he doesn't have to worry about me 24/7.
Good question.
That's a question.
The chaplain said, I got nothing.
I got the same problem. I can't get my kid to move out either. I don't know.
Go ahead, Larry.
I feel like I'm talking too much. I just remember that there were a number of occasions when Dr. Swoop had to make me go because I wanted to be there. I wanted to be right. Even with hospital stays, I was like, I need to stay the night at the hospital. I need to, and she was saying, "Go." That's why they have a staff. Go. And so it was that her continuing to tell me to go that helped me to understand I'm released. I did stay at the hospital on the nights that I knew she needed somebody there, but then I got the mindset of, it's whatever time and I'm gonna sleep in my bed tonight. I had to understand that I could go. So to answer your question, keep saying go. Yeah. Keep telling them you do not need to sit here and hold my hand. Just keep saying it, and it'll click. Secondly, I do want to say, is Ann Sojourner here? And I'm gonna ask your question that you asked at lunch. Ann said, we were talking about this whole caregiving world, and Ann asked the question, what do you do as a caregiver when you blocked out your day, you blocked out your week, and it's all around caregiving, and the person is now gone? What do you do with that? And I told her that doesn't have to be immediately. For me, that was 3 years down the road. After I sold the house, purged, bought a new house, moved in, and 3 years later, I said to myself, okay, what do I do with this? It took 3 years for me. What do you do, Dr. Dan? What do you do when you have all of this that you've built yourself around and it's gone?
Hand Dr. Dan a mic. Oh, he's going to go to it.
Thought I was done for the day. It's been 3 years. And I can echo what's all being said about my church family and how they came around and helped me. My children, although they live out of state, they were very key helping. So I would often travel to Orlando, Birmingham, spend time with them. I guess the first thing I had to do was just to go through the house and deal with her stuff, finances, all this just practical stuff that I had to manage. And to some degree, even now, I'm still dealing with some of that. Most importantly, though, and I've mentioned this before, on the day that my wife died, I was coming home from the hospital, and I had to stop and boost the charge in my car. And when I was at the charging station, a car pulled up next to me, and now the passenger seat was one of my patients. He lives in Cleveland. He doesn't have an electric car. He has no reason to be at that station, but when he said, "How are you?" I said, "Barbara just died." And we hugged. And I knew that was the Lord's timing. And so from that day forward, I learned to look for God operating in my life, and I still do that. The small things, the big things, which just reminds me that God has his hand on my life. When I returned to my practice, one of my former clients came back in. I hadn't seen her in a couple of years. She said, "My dad just died in March, and I need your help." I realized that I could now understand the grief she was experiencing because her dad was everything to her, as my wife was to me. So again, I see that even though I don't have Barbara in my life, God is still in my life, and he's still, more importantly, he's still using me. And he's using my circumstances to help others. So if you understand that you are walking his path and he has things for you to do, he's not done with you, and look for that. He'll show you the way to go. It may not be the path I want to go on, but it's the one he has for me. And as I have followed that path, despite discouraging remarks I've gotten at different times, I see him blessing me. I can't even begin to tell you how much of a blessing Liz is to my life. And it really is about we help each other through our losses. And my involvement in her family, her involvement in my family, continues to show God working through us. And that's what I look for. That if I'm still here, there must be a reason that God didn't take me to, or didn't take me first. So I need to pay attention to him and let him guide me on a day-by-day basis. Now, like Sarah said, if you ain't got God, I don't know how you manage. Because that's how I do manage, is having him. Now, so I have, I, as a therapist who works with non-Christians, etc., I can give some practical advice. But to really dig down to that deeper level, you have to understand where God is in your life.
That's right.
And receive that and work with that and bring him into the middle of your life. The more you bring him into the middle, the more you can handle those changes that go on in your life. So I hope that was helpful.
Thank you. Thank you. Thank you. I'm gonna close this chapter out with two things.
I'm sorry, I gotta say this. Some of you know this. 3 weeks ago, I was on Interstate 77 going north. The car in front of me slowed. I slowed. He stopped. I stopped. I'm sitting there. I check my rearview mirror. There's a truck coming, 55 miles per hour. He didn't stop. The back end of my car is like an accordion. He projected me into the car in front of me. The front of my car is like an accordion. I am blessed to be alive. I am still in pain. My shoulders, I can't raise my arms too well. But just for a while now, Liz has been my caregiver. And so some of the dynamics of, I wish I could still do all the things I was doing before. I know it's going to come back. They said 6 to 8 weeks. But before this conference, to realize that, well, now you're the one getting the care. And what's that feel like? So sometimes we feel bad because we're not as able to do and help like you were before. And so some of that can translate into some hard feelings for yourself, so on and so forth. But again, I now know that even that accident was part of God doing something. So I trust him. I have to trust him. Who else can I trust? So again, on a regular basis, I see God keep doing things. So thank you.
Thank you. Thank you. This has been quite a day. It's been quite a day. I want to speak on that question that Larry raised real quick. And I'm going to look at, I don't know if Dr. Marilyn's still here. Yes, she is. But she said something this morning. I think a lot of times when you hear the phrase grief recovery, you think it's because you lost a loved one. But I think grief recovery also applies to what Larry just talked about. Your whole life revolved around this person, and now they're gone. You had a routine, you had a regiment, you did it what? Every day, day in and day out, month in, month out, year in and year out, and now it's what? Over. Now there's a void. Maybe you need a grief recovery because now you're grieving. So don't just think this grief recovery is because you lost a loved one. There's so many avenues where there's a void there that the only thing that's going to take you out of it is some type of recovery process. Second thing is, does everybody know, let me go back to my buddy Brian. Does everybody know how an eagle gets rid of the eaglets? Because see, when an eagle has eaglets, even though they can fly, they don't want to what? They don't want to leave the nest. The only way they get these little eaglets to leave the nest, what do? They tear a hole in the bottom of the nest. In other words, they basically demolish. Brian, I'm not saying tear your house up. All I'm saying is, sometimes it takes something what? Demonstrative, drastic, because sometimes it has to be more than just what? Words. You know, we make that joke about when your kids went off to college, but don't worry, your room is going to become the, you come home, you don't have a bedroom anymore. It's been turned into a den. Well, that means this is not your room anymore. So maybe you turn this room into a, I don't know. But sometimes it's not just saying, hey, it's okay to go. Sometimes it's taking a stronger step. So I just wanted to throw those two things out there.
Well, thank you, Brother Marvin. One little point that you didn't put in is that when the mother eagle kicks the baby eagle out of the nest, if that baby eagle doesn't fly, the mother's food fabricates.
Well, I'm sure I know your son, and I know your son knows that you'll always be his safety net. I love it. I love it. I love it. Okay, one last thing. I'm going to turn it back over to Michelle to kind of close things out here. The conference evaluation. Please, on your program, before you leave, all you got to do is take your phone. You know, get out the photos. We'd love to hear from you because that's going to help us plan for next year. If you still have a flip phone, then there's a paper evaluation in your bag, and we're not gonna shame you. We're not mad at you. So we're prepared for both. Okay. So, but take a moment and fill out the evaluation. And again, thanks to our last panel here. Let's give them another hand. And we have some parting gifts for this group here too. Yeah. Oh, my junior said it's up on the wall. It's on the screen. So you can actually take your phone and do it that way too. Right, Junior?
I just want to say, it's been a wonderful day. And you know, like I said, I hardly know any of these people, word of mouth. And so we thank God that He worked it out. And I just something just dropped in my spirit. Don't despise the feelings that you have right now. Let the Lord work them out. Okay. I want to thank God for this marvelous day, Pastor Chuck and Lady Sherry, the executive Pastor Ron, our visionary, Marvin Montgomery, the medical board. I asked the medical board and they just came on, and others, and I want to give a shout out to Mary who did that registration, and she did it to a T. Monique Toppin who made the bags, so we have our own in-house creativity. Hold on. The tech team, the greeters, you saw the young people, the custodian, security, the photographer, the panelists. And extra clap for our young 19-year-old Sarah. And to our vendors and resource, dining with distinction, I hope you all enjoyed the lunch. And thank you to you all, because this would not be possible if you weren't caregivers. And to our sponsors again. I am the lead person for the Caregivers Assistant Ministry, and it's a new ministry. So if you are interested, it's on the bulletin, just send your information to that email address. And I like quotes, and I want to leave you with this thought. There are two things we get every day when we wake up: a chance and a choice. Each new day offers us a chance to make a difference, to show compassion, to continue the incredible work of caregiving. And with that chance, we also have a choice: how we show up, how we respond, how we use our energy to bring hope, comfort, and dignity to our loved ones. Today, we shared stories, wisdom, and encouragement. We hope that you leave here reminded of the power you hold in both the chances you've given and the choices you make. Thank you for your compassion, your resilience, and all that you do every single second of each day. Blessings and strength to you all.
$2:31. What y'all gonna do these next 29 minutes? Thank you again. Enjoy the rest of your afternoon.